A lot of guys worry about their semen volume, but why? And when do you actually need to be worried? Stick around to find out more. Hi guys, I'm Dr. Lane from Adelaide, South Australia, coming to you with information about men's sexual health. So a lot of guys do worry about semen volume, and they will often make an appointment to come and talk about fertility testing or getting hormone levels checked. I also get a lot of questions about supplements and what you can do to increase semen volume. So in this video, I'm going to cover it all, and I'm also going to tell you what you should be looking out for, when you should be worried, or go and see a doctor. Now, before we get to the topic of normal semen volume, let's start with a few basics. What is semen? Semen is the fluid that comes out of the penis during an ejaculation. And it's important to know that it's not the same thing as sperm. Sperm is one of the components in semen, but it accounts for less than 5% of the volume. More than 95% of semen is actually produced in the seminal vesicles and the prostate gland. Okay, so let's get on to semen volume. Why is this important? To be honest, it's not really that important. For a lot of guys who watch porn, they can compare themselves to what they see in videos and then think they should be producing a lot more semen than they actually are. But you got to remember that porn and real life are two different things. The normal range for semen volume is anywhere from around 1 to 5 mils. 5 mils is the size of a teaspoon, which means that even if you're only ejaculating about 1/4 of a teaspoon, that's still considered normal range. You might find, however, that the volume of semen changes depending on how often you are having sex or masturbating. For example, if you go a couple of days without sex or masturbation, you'll probably find that the semen volume will be increased. In other words, if you want to increase your semen volume, one way is to abstain from ejaculating. Apparently that's what the porn stars do. Another thing you might consider is pelvic floor exercises, specifically Kegel exercises. Now, Kegel exercises are particularly helpful for men who suffer with bladder problems or erectile dysfunction. But they're also thought to help with semen volume because they strengthen the muscles that work during ejaculation, making the ejaculation stronger. Now, there's a great channel by an Aussie physiotherapist called Michelle Kenway. I'm going to put the link in the description below. If you want to check out some of her videos, she's got some excellent instruction on how to do Kegel exercises safely and in your own home. Okay, the question you're all waiting to ask. Are there any situations in which low semen volume might be an indication of a problem? Well, the answer is yes. But to help you know when you should go and see the doctor, here are a few specific things you might want to take notice of. The first is a sudden or unexpected change in semen volume. In other words, if you're one day shooting 5 mils and then the next day for no reason at all it drops to 1 mil, then I would advise you go and get that checked. If you've had any recent surgery, particularly focusing on the genitals or prostate, then that would be another reason to go and talk to your doctor to make sure there's nothing else going on. Another red flag is actually any symptoms that could mean that you have high blood sugar. And that's because having diabetes can also affect your semen volume. So symptoms to look out for here are things like excessive thirst or going to the toilet all the time, even just unexplained fatigue or changes in your weight. Very easy to test for. With a finger prick, you can normally check your blood sugars pretty easily, but something you should go and speak to your doctor about if you're worried. Then of course there are things like medications. Now, rather than list all the different medications that might affect semen volume, I would just say that if you're taking any medication or you've changed medications and you've noticed any pattern or relationship with semen volume, then definitely go and chat to your doctor or even your pharmacist to see if that could be related. And then finally, if you have a partner and you're trying to conceive and having trouble, then that's also something I would advise you go and check in with your doctor about. It will probably result in them ordering a semen test to check if you've got viable sperm or if there's any reason why fertility might be affected. Okay, now what about supplements? There are heaps of supplements on the market that say that they can increase your semen volume, but do they work? No. Actually, I'll take that back. There is no evidence that taking supplements can change your semen volume. Sorry guys. Hey, I'd rather disappoint you now than have you waste your money and be disappointed later. Now, if you're new to my channel, you should check out some of my other videos. I'm putting one on the screen right now. And if you have subscribed, don't forget to hit notifications so you can stay up to date with my new content. Stay healthy guys, I'll see you soon.